Today I'll be talking about echocardiogram. I chose the first video to talk about. An echocardiogram is basically an ultrasound test that can elevate structures of the heart as well as the direction of blood flow within it. So an ultrasound means it doesn't use radiation and it uses sound waves to produce an image on a monitor screen that physicians can use to interpret and tell the patient what's going on in their heart, if they have any symptoms of heart disease or anything alarming that they can talk to the patient about to make them aware of it and provide further action. Some pros and cons of an echocardiogram. A pro would be that it doesn't use radiation and is non-invasive, which I'll talk about a little bit more in the next slide. It is in real time, so it shows your heart contracting in real time, and it's accurate and can find symptoms of heart disease, which is really important. Cons, a technician must be qualified in order to perform the test, so it's not readily available for anyone. You have to go in and see someone who's qualified to do it, and then even then, usually it's transmitted to a physician that will interpret the results. So no radiation used in echocardiogram. Radiation is very harmful to the human body. It's important to limit radiation exposure as much as you can, which is like in X-rays. And radiation can harm the body by killing cells or mutating cells, which can cause cancer. That's why it's very important and very good that the echocardiogram doesn't use radiation, because just any form of radiation can really be harmful to the body. What does an echocardiogram measure? An echocardiogram can estimate the sizes of the chamber walls of the heart. It can show the movement of heart valves, and it can produce or show an image of the heart using sound waves. It can detect if the heart muscles are not contracting normally due to poor blood flow or various other reasons, and can evaluate heart murmurs, blood clots, tumors, aneurysm, all sorts of different symptoms and diseases. So how is an echocardiogram test performed? It is much like a pregnant woman coming in to get a sonogram of their baby. So a qualified sonographer will spread gel on your chest. So instead of being on the abdomen like a pregnant woman, it'll be on the chest because we're looking at the heart. Then the sonographer then will press the transducer firmly against your chest, which is just the part of the device that will send sound waves. So an ultrasound beam will be transmitted through the transducer through the right ventricle, then to the interventricular septum, and then into the left ventricle. And then it'll record the sound waves. That will be translated onto the monitor and will show a picture of the heart. So in this next slide, you just see pictures of a normal echocardiogram. You can see the right atrium, right ventricle, left atrium, the left ventricle, mitral valve, tricuspid valve. So this is a normal echocardiogram, not much going on with it. And in the next picture, you just kind of see how it's performed. The patient is kind of laying a little bit on their side. The gel's on him. There's the little transducer that the sonographer is holding onto him. And so yeah, that's basically how that looks. And then just some abnormalities. Heart size abnormalities can be detected on this echocardiogram. It can have weakened or damaged heart valves, or high blood pressure can cause the chambers to enlarge, so you can see that on the echocardiogram. And you can see pumping strength, so you can see if the heart's not pumping enough blood. Damage to the heart muscle can tell if parts are moving weakly or not receiving enough oxygen. And valve problems, you can see if the valves aren't opening enough for adequate blood flow, and also you can see heart defects that have been present since birth or any other type of defect.